Hello, my name is Nicole Johnson, and I will be discussing in this speech stimulant use disorder. First, I want to explain what a stimulant is. Stimulants are drugs that speed up the body system, resulting in increased alertness, attention, and energy. These highly addictive substances are available legally or illegally. The illegal stimulants are, for example, cocaine in the form of crack, which is a rock substance that can be smoked, or coke, which is a powder substance that can be sniffed through the nose. Amphetamine, which is speed, can be done either by pill or by inhaling, um, or even sniffed. Methamphetamine, which can be done either by inhaling or sniffed. And MDMA, which is mild. And usually that's done by pill form, so you ingest it. Um, the DSM-5 criteria identify 11 symptoms and clinical features for diagnosing stimulant use disorder. At least two signs must be present to qualify as a disorder, but the individual's behaviors may still indicate that they are misusing the substance. The presence of tolerance and withdrawal is no longer a necessary or deciding indicator of an addiction. When it comes to the symptoms, as I stated before, there are 11 symptoms, uh, but the most prevalent of those symptoms are taking stimulants more than prescribed if it's a prescription, difficulty decreasing or stopping the use of the stimulant despite wanting to, uh, cravings and urges to use, uh, continued use of the stimulant despite any negative impact on your life, like attending school, going to work, problems with your marriage or in a relationship. Um, while there are uh, no approved medications to treat stimulant use disorders, counseling and behavioral therapy, such as cognitive behavioral therapy or CBT, have proven to be effective, um, combined with supportive services like outpatient, inpatient, um, a psychologist, therapy. Unlike alcohol, though, stimulant withdrawal and detox are not medically dangerous, but they may result in like unpleasant feelings and severe depression. Um, and because of this, individuals that uh, are detoxing should be carefully monitored for risk of suicidal thoughts because um, those thoughts are rampant when using illegal drugs. Um, but recovery from stimulant use disorder is possible, but it requires dedication, stability, and support. Ongoing care is necessary to sustain recovery and your overall mental health. Um, Patients should be actively involved with their care at every step of the way, and treatment should always be um, absent from judgment uh, based on prior decisions or choices that were made. Um, a case study. Um, Tony uh, is a 47-year-old black female. She has two children, ages 27 and 24. Um, she is a survivor of sexual molestation and child abuse. Sexual molestation started at the age of 6 and continued to the age of 12. And the child abuse, physical abuse by the hands of her stepfather started at the age of 7 and continued until She was 18. Um, uh, and although she survived it, she's still a victim of physical and verbal abuse from her boyfriend. Um, Tony has been diagnosed with post-traumatic stress disorder and manic depression. Um, she constantly feels that she's worthless and always has thoughts of suicide. She began smoking crack cocaine in 1995. At the age of 19, she could not uh, feel anything when she was out. On numerous occasions, she smoked so much just to try to get her heart to explode. That was her form of suicide, but she couldn't see herself, um, cutting her wrists or anything like that. Um, uh, she could not maintain a job and was moving from house to house. And then in 2007, Tony was sentenced to prison for 2 years for drug possession. Um, in prison, she began attending AA. And once she was enrolled in 2009, she moved into a treatment program known as Safe Haven. She stayed there for a year, um, and she attended AA. She had gotten a sponsor. She was doing outpatient therapy. She also had a psychologist to help her with her depression and her post-traumatic stress disorder. Um, and 15 years later, uh, Tony has maintained uh, her sobriety. Um, she has worked her 12-step program. Whew, in those 15 years, I'd say she's worked that program at least 25 times. She stays in constant contact with her sponsor. She still sees a psychiatrist and a psychologist. Um, she has suffered some issues because of her uh, drug use. Um, Mostly it deals with her memory. Um, she has a hard time retaining information that she's read. Um, Sometimes she has a problem uh, putting sentences together, or they form in her head. She knows what she wants to say, but speaking it verbally, it does not come out correctly. It seems long and drawn out. Um, but she has maintained a job for many years now. Um, Her family's back together. Uh, she has gotten married. Um, she has her and her husband own their own business. Um, and she's able to cope with uh, day-to-day living without having to use uh, a chemical substance um, to be able to live and function. Um, so recovery is possible if you want it and if you work the program. If you accept the help that's needed and you take the advice that's given and you actually work it, it is possible. There is always a yet. Um, Relapse is a major part of uh, Tony's life because anything can set her back, but she wants to remain among the living. So, um, yeah, you can recover from substance use disorder, but you must want to recover from substance abuse disorder. Thank you.